Hello everybody from sunny Athens. I am delighted to be invited as a speaker today, and I would like to thank Jeisys for the honor and for the opportunity. Okay, so as Christina very kindly introduced me, I'm a dermatologist based in Athens, Greece, and basically I'm running my own private practice where I deal with every aspect of dermatology, both clinical and cosmetic. And having a background in photodermatology for many years, I am very fond of using lasers and lights in my treatments. And one of the lasers that I'm using lately is EdgeONE, which has been a valuable addition to my collection. So I'm going to share my experience with you today. And although this presentation has been prepared for Jeisys, I have to say that there was no involvement of the company in the content of the presentation, and it was not influenced in any way by the company. So here is a general overview of the topics we are going to touch today. And let's begin with the skin. So, you know, the skin is our biggest organ and it does a lot of things for us. Apart from being a physical barrier that covers our body and protects the underlying tissues, it is also a sensory organ. It is the place where vitamin D is synthesized, and it is an active immune player. Actually, we have more immune cells in our skin than in our blood. And even the keratinocytes, as you might know, play a very important role in the immune response. Being a physical barrier, our skin is exposed to many environmental hazards, and one of the major threats to the skin is ultraviolet radiation, which directly damages the DNA in the skin cells, but also produces oxidative damage to the cells and influences the functions of the skin. Fortunately, our skin has redundant repair mechanisms to overcome this actinic damage. Nevertheless, the repair process is complex and slow, and the mutations accumulate as we age and as we are constantly exposed to the sun. And this can result in photoaging and cancers of the skin. But you will see that we are able to reverse photo damage by using fractional CO2 laser. As a physical barrier, our skin is subjected to a variety of mechanical injury, but it has an amazing ability to heal. So when the skin is teared and there is bleeding, inflammatory cells come in, immune cells, so there is an inflammation phase initially, and quickly after starts the proliferation phase, where the repair of the epidermis is produced, and later on we have the remodeling of the connective tissue. And this later fourth phase, it lasts from weeks to months after the initial injury. It is very interesting how keratinocytes migrate to the wound area, both from the edges of the skin of the wound, but also from deep from the hair follicles. And this process is the same which takes place basically after fractional CO2 laser. Having said that, let's see some things about the surgical CO2 laser. So lasers are optical devices which emit monochromatic light, and in this case the wavelength of the light is 10,600 nanometers, and this wavelength, it is it is absorbed by water, selectively absorbed by water, as you can see here. So in the case of CO2 laser, the chromophore is water, and water in the tissue, both intra and extracellular, represents about 70% of soft tissue, but the actual target of the laser are keratinocytes, collagen, vascular structures. So when the incident laser energy impacts the skin, it is absorbed by tissue water. And at the point of impact, the temperature raises above 100 degrees. So we have vaporization of the tissue. And this equals to ablation, okay? And deep down underneath this ablation zone, we have diffusion of thermal energy and coagulation of the blood in the vessels. But there is also residual thermal energy which penetrates deeper and produces protein denaturation. And this leads to collagen shrinking. And there is also another very interesting process because there are some photons from the laser reaching deep inside the tissue, but they do not have enough energy to produce heat, but they activate a healing process, and this is the photobioactivation effect, which is very, very important in healing. So when we fire the laser, we can either have a continuous wave, like in this diagram, and in this case, the laser is used as a scalpel. It cuts, but we also might have a chopped, a switched wave. And when this chopped wave, the pulse width is in the range of milliseconds, it is called quasi-CV. And this quasi-CV, when it has very high pulse energy and very, very short pulse duration, we are talking about superpulsed or ultra-pulsed modes, which are jar-free because they have minimal residual heat in the tissue. So we may use CO2 laser either as a surgical tool for the removal of different skin lesions like seborrheic keratosis, milia, xanthelasmas, warts, and so on, either in a scanned mode over the whole surface of the skin for treating skin laxity, wrinkles, scars, and so on. And here are some examples of cases from my practice. This is a lady in her 40s. She was bothered by 2 seborrheic keratosis she had on her left cheek. So she wanted them removed, and I used the CO2 laser, the surgical handpiece. So this is just right after the removal, and the image on the right is 1 month after the procedure. And you see the nice result. Another patient of mine with multiple seborrheic keratosis on the face, very nicely removed by CO2 laser. And the result is again 1 month after the laser. Xanthelasmas. They are a little bit more difficult than seborrheic keratosis because they are deeper lesions, but CO2 laser may be used and it has very nice results. Here we removed the xanthelasmas and the results are 2 months after the laser. And another case, a younger patient, again with xanthelasmas, and the result 1 month after the laser. Moles. I prefer not to remove moles by laser because I always want to have a sample to send to the pathology in order to be sure what I have removed. So although I use dermoscopy and I take pictures and I'm quite sure it's a mole, in this case of mixed dermal nevi, I prefer to do a shave excision and then even out the base with the CO2 laser, because in this case, the healing is very nice and the result is cosmetically excellent. So this is the way that I treat moles with the laser. And obviously, the removed part of the mole goes to the pathology, and I have documentation, a final diagnosis of what was removed. So you see that compared to classical scalpel CO2 surgical laser, it is minimally invasive, it is bloodless, it has less discomfort, and it has this nice and rapid healing with reduced scarring. In the years, in the late 90s and the beginning of the year 2000, the gold standard for treating facial wrinkles and scars was ablative laser skin resurfacing. So the laser in these cases was used in the continuous wave mode, and it removed all the epidermis and part of the dermis, and then a healing process started, which usually lasted for weeks. So it had a very long downtime, although in selected cases, the results were amazing. Nevertheless, the potential adverse effects were quite serious. So the complications, the possible complications were persistent erythema and edema, post-inflammatory hyperpigmentation or hypopigmentation, and as you see in the picture, sometimes very, very severe hypertrophic scars. So in order to overcome this long healing time and the adverse events of the ablative laser resurfacing, the fractional technology was discovered. And actually the concept of fractional photothermolysis was first described by Rox Anderson, my professor at Harvard, in the year 2001. And it was further developed by Dr. Dieter Marnstein with the advent of the first fractionated system. So fractional lasers actually, instead of having, this big beam, the beam, it is divided in micro beams. So these micro beams produced small areas of ablation in the skin, having in between them large areas which are not treated and from where the healing process starts. In other words, multiple laser beams, you see here, create micro holes in the skin, and as I explained to you before, with this injury in the skin, the repair of the epidermis starts, and this is a process which is usually completed in about 14 days. So you see here the OTC image, but after the re-epithelialization of the epidermis has been completed, there is the connective tissue, the production of collagen and elastin, which goes on for the next weeks and months. And actually, laser thermal energy produces collagen denaturation, as we said before, and collagen fibers contract and become thicker, so there is also an instant tissue tightening effect. So in order to do the treatment, the physician has to select the right parameters. Usually we can choose the dot size, the pulse energy, the pulse duration. Their quotient equals the power of the treatment, the dot density per square centimeters, and the spot shape and size. So in this way, fractional CO2 treatments are precise and rapid, well tolerated, with predictable and reproducible results, which have a quick healing time, minimum downtime, and very, very nice cosmetic results. The indications for fractional CO2 laser comprised photoaging, dilated pores, wrinkles, skin laxity, scars, all kinds of scars, difficult to treat cases of melasma, as you will see, and delivery of drugs through the skin. And again, I'm going to show you some results from my practice, but before, I have to say that it is very important to prepare the skin for the laser. So here is a lady in her 60s, and she never had done anything before on her skin. So before doing fractional laser, in this case, I did microdermabrasion. I used the KTP laser to remove the brown spots and the telangiectasias. And I recommended skincare products. And this is the result as the skin was prepped. And on the skin, the fractional laser will work much, much better. So if the patient has a history of recurrent herpes simplex, we might use antiviral treatment. We might also apply a non-anesthetic cream, and it is very, very important to disinfect the skin well before performing the treatment. During the treatment, we have to protect the eyes of the patient. Always use wet gauze and non-inflammable disinfectants, or we have to rinse the disinfectant with some saline. And also it is important to have a smoke evacuator, because I think that now you might see better, because there are usually in the laser plumes, there are infectious particles. And after the treatment, I recommend cleansing with a mild soap, hydrating, and use of healing cream or gel. And it is paramount to use sun protection. So this is one of my favorite patients. She's in her 70s. She never went to the dermatologist before, so she wanted to do something to rejuvenate her skin. So I immediately thought about fractional laser. So you see, we did one session of fractional CO2 on the face, and just 1 month after the laser, you see the difference in the depth of the wrinkles and the texture of the skin. A younger patient of mine with deep pores. So we did the treatment, and about 6 months after, when I saw her again, the pores were more shallow, and she was quite pleased with the result. Here is a patient with severe acne, which I treated with isotretinoin, and there were some scars after the treatment, so we decided to do fractional CO2 laser, and you see how nicely the scars almost disappeared after one treatment. This patient used to have a mole on the tip of his nose, so he went to a surgeon and he had the mole removed, but instead of it, a scar was formed. So when I saw him, I offered to revise the scar. I did some, I treated it with fractional CO2 with 2 passes. The first one with high energy, high density, right on the scar. And the second pass with a 350 micro tip on the whole tip of the nose. Then I lost him from follow-up, but when he came in for another reason, after 18 months, the scar was not anymore there. So he was very pleased with the result. This is a patient with multiple moles, so he came for a mole check, and I detected this mole, which was rather dysplastic, so I decided to remove it. We did the surgical excision, and on the day that the sutures were removed, I treated the surgical scar with the fractional CO2 laser. So you see, 10 days after, there is almost no sign of the sutures. So this is a treatment that can prevent scar forming. Stretch marks, difficult to treat. I usually do 2 passes. The first one just on the stria with high pulse energy and high density with a 120 micro tip. And the second pass on the whole area with a 350 micro tip with lower density. I usually space the sessions 6 months apart. So the final picture is about 2 years after the first one, because there were 3 sessions at 6 months intervals, but you see the waiting was worth and the result was very good. So here we had a treatment for rejuvenation of neck and décolletage area. I first used the surgical mode to excise this thin seborrheic keratosis, and then I did the fractional treatment all over the surface of the skin. And this is the result 3 months after the treatment. Melasma, always a challenge. In cases of melasma, I keep the laser as the last resort. So you see this patient had severe melasma on her cheek, on her forehead, on her upper lip. So between picture 1 and 2, I did microdermabrasion, KTK laser for the brown spots. I did chemical peels. I used Klickmann solution, and this is the result that I could get with all this. And then on this residual deep melasma, the fractional laser came in, so I did 1 session of fractional, and we had very nice clearing of this resistant melasma, you see, 1 month after the laser. Another case with melasma and acne scars, again treated with fractional CO2. I just want to point out that select cases of melasma can be treated, but always with caution. We need to use low density settings and low pulse duration and wide treatment intervals, because the danger with the melasma is post-inflammatory hyperpigmentation and rebound and worsening of the initial melasma. So we should be cautious with these cases. There are some limitations for the use of fractional CO2 treatments, which are dark skin types, patients with healing disorders, those who cannot defy intense sun exposure, and the associated risks are persistent erythema, cutaneous infections, hyperpigmentation, and less often scarring. And in order to have a successful treatment, it is very important to do the right patient selection, to set the optimal parameters for each treatment, to be adequately trained, and of course, to have the right laser. And I thought it would be interesting to add an insight into the use of fractional lasers as new therapeutic modalities for certain skin conditions. A relatively new concept is laser-assisted drug delivery, where we use the microchannels produced by the laser as a gate to deliver into the skin active substances to enhance this therapeutic effect. So you can see here in this publication, the CO2 laser was used in order to treat, for example, actinic keratosis and allow substances to penetrate into the skin, to treat hemangioma, different alopecias, onychomycosis with topical antifungal, scars. So this is a very interesting concept, but since it is quite new, there are many things that remain to be defined as to which is the optimal laser fluence, which defines the depth of the channels, which should be the density for each treatment, what is the role of the coagulation zones, and which is the best timing for the application of the drug. And here, let's have a glimpse to the most recent bibliography. You see that fractional laser, either alone or in combination with different active substances, can be used in androgenic alopecia, or for the treatment of hypertrophic scars and keloids, or as a treatment for vitiligo and even for lichen sclerosus. Finally, this research paper coming from Harvard Medical School unveils an unexpected potential of fractional CO2 laser triggering an anti-tumor response, not only locally, but also as a systemic anti-tumor adaptive immune response. And if this is true, it would be amazing to know that by treating our patients with sun damage, we could minimize their chances of getting skin cancer. And now let's have a closer look to EdgeONE fractional laser. EdgeONE actually is 3-in-1, as it displays the fractional handpiece, the surgical front handpiece, and the vaginal one. And as you see from the technical specifications, it is a powerful laser with a lot of tunable parameters which make it very versatile and very, very precise. It has a choice of 5 interchangeable tips of different dot sizes, and I like very much the fact that there is also this surgical tip, so you can adjust it to the handpiece, to the fractional handpiece, and switch from the fractional to the surgical mode. And it has a variety of scan sizes and scan shapes, square, circle, triangle. And I have to admit that I really love these two magical buttons that you can change the shape and the size directly from the handpiece, and you don't have to run over the screen to the screen of the laser every time. It is a modern laser as it boasts this high peak, very short time edge pulse, which is in the category of char-free pulses. And in a nutshell, it is ergonomically designed, it is very user-friendly, versatile, precise. You can do patient-tailored treatments, minimally invasive, in-office with minimal downtime, well tolerated, and the laser has no consumables. And for the end of this presentation, I have included two very short videos to show you how I perform the treatment. So this one is a rejuvenation of the décolleté area, where you see that actually I scan the whole area with this mode in order to deliver the precise energy. I don't do overlapping. I do this stamping. I cover the whole area, and then I do this feathering at the edges of the treated area in order to eliminate the demarcation lines between the treated and untreated skin. And the second video, this is a patient with treatment-resistant lichen sclerosus. She had for quite a long time different topical treatments. So I used the CO2 laser as a device in order to use the PRP in combination with the CO2 laser. So we did fractional CO2 and PRP. And with this, I would like to thank you very much for your attention. And I hope and I wish that the things will get better with the pandemic, hopefully with the advent of the vaccines, and you could come and visit Athens if you wish. So thank you very much.
Dr. Athina, please select a few questions, maybe 5 or 6 questions would be the best.
So I have opened the Q&A question section, so I can see already 10 10 people who have asked questions. So the first one says, which setting is recommended for using and for treating periorbital region, and particularly festoons? Well, I surely use fractional CO2 for treating the eyelids. Usually I use the 120 micro tip with a 6 millijoule energy and about 600 to 1000 milliseconds and a density of about 100 dots. Festoons, I would say they are quite difficult to treat, because if the skin excess is very significant, then in this case the fractional CO2 won't do a lot of difference, so one has to treat them surgically. Okay. The technique for treating scars, well, it depends on the scars, but if the scars are deep, first I do an undermining under the scar, and then I might use the laser as I showed to you with higher density and higher fluence parameters right on the scar. And then again, I go a second pass over with the lower parameters. For acne scars, I would say it is very useful to use also there is a spot mode which is called Gaussian, where it has a higher density in the center of the spot, and then as it goes to the periphery, the dots become less dense, so the energy is concentrated at the center of the lesion, and this is quite useful for acne scars. You can go first on each lesion and then do the fractional treatment over the whole surface of the face. Yeah, so the next question, how do you choose between 120 and 350 tip? To tell you the truth, for most of my treatments, I use the 120 tip. The 350, I might use it as a second pass after the 120, either in treating stretch marks or on scars. Yeah, about the lichen sclerosus I have showed to you. I have searched also the bibliography. It is still an experimental treatment, but which is very, very promising. So I can say that I have seen good results in my cases. Which settings do I use? Well, for lichen sclerosus, it depends on how firm and how, you know, it depends on how the lesion is. So usually I want to go deep, so I use high fluence, about the 120 deep, about 15 millijoule, and low pulse duration, because I don't want to deliver heat. I just want to break the collagen fibers in the lesion. So it might be about 500 or 600 milliseconds, the pulse duration, and high density of more than 144 dots. Melasma, as I said, we have to be cautious, but I think I have explained how we work on melasma. Double stack, I don't use it very much because I like to do two passing instead. Okay, so let me see if there is anything that I can answer. Okay, for treating dark phototypes, it's quite a challenge. So I usually refrain from doing fractional laser on very dark skin. But if I have to, I prepare the skin using different topical solutions, and especially Klickman formulation to pre-treat the skin. Then I might do the fractional laser, and again after the fractional I might recommend using continuously the Klickman solution. So yes, I don't combine laser with isotretinoin because isotretinoin, I believe that by itself can significantly improve both active lesions of acne and scars. But I use the laser after the isotretinoin treatment has been completed and there are residual scars. Actually, conforming to the latest bibliography, we don't have to wait for such a long time, so we can perform the laser 2 or 3 months after the completion of the isotretinoin regime. So I think I have covered most of the questions here. Do we have anything else? Christina?
Oh, well, I think it's time to finish it. Is it okay? Or
yeah, I think I have been through most of the Q&As.
yes,
So
right.
if there are no other messages in the chat or any other questions, I think we can close here.
Okay.
So again, I would like to thank everyone for joining in, and I would like to thank Jeisys for giving me the opportunity to be your speaker today. It was a great pleasure and honor for me.
All right. So, okay, I think it would be good to finish the Q&A section at this point, right?
Yeah.
All right. So, to audience, the question left behind, we will send an email if you have another question. And thank you for your kind and specific answer, Dr. Athina. Thank you again.
Thank you. Thank you very much. The pleasure was all mine. Thank you.
Thank you. So, to audience, it's time to say goodbye. So, if you have any question about today's webinar, please send an email at serge@jeisys.com. Once again, thank you for joining the Jeisys webinar. And don't forget to submit a survey at the end. And have a great weekend to all. Thank you, Doctor. Thank you, everyone.
Thank you. Have a great
Bye.
weekend too. Bye-bye. Bye.